Our paper in DMCN is a systematic review of the validity and reliability of radiological methods assessing the proximal hip geometry in children with cerebral palsy. What's already known about this topic is that hip migration is associated with acetabular dysplasia, increased femoral neck shaft angle, and increased femoral anteversion in children with cerebral palsy. Radiological surveillance of these deformities through growth remains a challenge. Indeed, numerous imaging techniques are used to evaluate hip and femoral parameters, as migration percentage or neck shaft angle using plain radiography, or for instance, femoral anteversion using CT scan. Numerous techniques have, however, been described in the literature in studies of varying quality, making analysis difficult and justifying a systematic review in order to determine which techniques are the most valid and reliable. What's new in our article is an exhaustive assessment and analysis of evidence of the metrological properties of the image-based measurement of the proximal hip geometry in the specific population of children with cerebral palsy. As a main result, along the 19 articles included, we found that migration percentage, acetabular index, neck shaft angle measurements, and the Robin and Graham classification, all based on anteroposterior X-rays, have shown good to excellent concurrent validity and reliability. However, more metrological evidence is needed for the assessment of femoral anteversion. MRI and ultrasound-based measurements have great potential, but few metrological evidence are available to date as well. Thus, we recommend further validation studies for these non-irradiative methods for hip geometry assessment in children with cerebral palsy.